Hello, everyone. It's Kurt Calker, the registered nurse here at Cape Ann Botanicals and Cape Ann Cannabis here in the North Shore of Boston. I wanted to take some time to talk about methods of consumption, how you consume cannabis, or routes of metabolization that we call it as well. People tend to think when we use cannabis or CBD as a medicine that we're walking around high all the time, and that's just simply not true. There are many ways to consume CBD and cannabis. The first thing that we always want you to remember is start low and go slow. Everybody responds differently. So you want to start out a small amount and increase that amount until you get the desired effect to reduce any unwanted side effects. There are many different products here in Massachusetts that we have now. Edibles, which are, cookies and gummies and capsules and teas and beverages and chocolate and honey, you name it, we have it. Sublinguals. Sublinguals are oils we put under our tongue, CBD, cannabis oils, tabs or strips. We have topicals, topical creams and lotions and salves that we put on our skin. Transdermal patches that are patches that stay on us for a couple days and give us a really good duration of relief. Suppositories, vaginal or rectal. They work really wonderful for pelvic floor disorders for women. And for transdermal patches, we see really good pain relief for back pain. All of these have other additives in them, or we call accipitants, that actually are additives that are there to help with absorption. So each product's a little bit different, so be careful. Inhalation is one of our most popular administration routes, and it's always not the best when we're looking at medicinal. We're taking something in our lungs that might not really be the best for us. So smoking flower, not the best. Dry vaporization of flower, I would definitely recommend more than lighting up the flower. Vaporizer pens, they've gotten better now because we have really good regulations that say what goes in a vaporizer pen now, so they're a little safer. But I would go with the dry vaporizer. That would be something better. Then we have dabbing with inhalation, which is very concentrated product, which you have to be very, very careful with. Each one of these administration routes or methods of consumption have an onset, when they begin to affect you, and how long they last. Edibles last, they come on in about 30 to 60 minutes and last anywhere from 6 to 8 hours. Sublinguals, they start to work about 10 to 20 minutes, and then they last 6 to 8 hours. Topicals, they start anywhere from 5 to 10 minutes and then last 2 to 4 hours. Transdermal patches, they start their onset usually about 10 to 20 minutes and can last up to 4 to 8 hours, sometimes 96 hours, depending on product. Suppositories, 10 to 20 minutes onset, 4 to 8 hours, up to longer sometimes, depending on that chemical they put in there to help absorption. And then inhalation, the quickest route, which really works great for anxiety and pain. But remember that smoking bit, we have to be careful there. 1 to 15 minutes onset, 2 to 4 hours usually is duration. But if you smoke a very, very concentrated form or strong form of cannabis, it can last up to 8 hours or more. Each one of these products has its own onset and duration, so remember that. Be careful, each product's a little bit different. I use multiple different forms. I take a high CBD oil in daytime and early evening, and then when I have breakthrough pain through the day, if my shoulders bother me, I will put a topical on that will help me so I don't have to reconsume more CBD. I just focus on relieving that pain locally. One of the main reasons we see people not getting effect with the CBD or cannabis product is consistency and longevity. You have to take these products for a period of time. We want to look at 2 to 4 weeks, and people tend to take a CBD product once and go, it didn't work. Well, it really doesn't. Cannabis doesn't work that way. If we look at the pharmaceutical industry, that's a very similar thing. When we give you an antidepressant, we don't look at your first day. We look at your first month up to 6 months. That's the same with most other pharmaceuticals as well, like blood pressure medicines, anti-anxieties, or any cardiac medication. We look at your 1 to 6 month period of time. So realize that cannabis is very similar in that realm. You've got to give it some time and be patient and let it work. Go low and go slow. So thanks so much for taking the time to watch my video. If you have any other questions, please reach out to me at the Cape Ann Botanicals website. You can email me or make an appointment. But thanks for chiming in, and stay safe and be patient. Take care.